Just as plucking an evidence-based treatment manual off the shelf is never going to guarantee a positive outcome for a particular client. Measurement-based care needs to be considered part of a broader evidence-based practice process, that integrates clinical judgment, individual differences, and preferences. Nearly, if not all, experimental investigations of measurement-based care in behavioral health can be thought of as additive design trials. So these are comparing routine treatment based on clinical judgment alone with routine treatment plus some sort of measurement-based care feedback intervention. So it's all of what we know about measurement-based care is essentially a test of augmenting clinical judgment, which ideally is going to include collaboration with one's client. So setting that aside, most MBC tools are outcome focused. They track relevant symptoms and functioning domains. They don't need to be. They could be more process focused, but most of the research has been on outcome focused. And so when predictive analytics are applied in automated feedback systems like we've talked about so far, you can learn if a client's on track or not for a positive or negative outcome. If things are on track, then that's great. And that gives me some indication that I can stay the course or maybe even consider discussing termination with a client. But if things aren't on track, most feedback systems aren't even the most sophisticated available, aren't going to tell me exactly what to do next. There's a signal that I need to consider potentially doing something different. And I might need to revisit my understanding of the problem. I might need to revisit my treatment plan, my technical approach, again, in collaboration with the client. There are systems that supplement the outcome analytics with decision support tools that will direct you to additional assessment to try to home in on what might be stalling the progress. Is this an alliance quality issue, as an example? But even with these, they're generating clinical hypotheses, that the clinician then needs to consider and then test themselves with the client. So measurement-based care is always a tool. It's really nothing more than that. It provides a signal, and as a mental health care specialist, my job is then to try to translate that signal from that evidence-based tool into something that's personally relevant and helpful to this particular patient.